This is test 4 lecture notes for the heart criteria. Number 1 interpretation is the normal sinus rhyme. The heart rate is 60 to 100 beats per minute. The rhyme is regular. The P wave is before each QRX complex, similar, upright, and lead 2. The PR interval is 0.12 through 0.20 seconds constant. The QRX complex is less than 0.12 seconds. The QT interval is less than 0.44 seconds. The notes are that SA is the pacemaker of the heart. Number 2 interpretation is sinus bradycardia. The heart rate is less than 60 beats per minute. The rhyme is regular. The P wave is before each QRX complex, is similar, upright, and lead 2. The PR interval is 0.12 to 0.20 seconds constant. The QRX complex is 0.12 seconds. The QT interval is less than 0.44 seconds. The note is you should notify a nurse if the heart rate drops below 50 beats per minute. Number 3 is sinus tachycardia. The heart rate is greater than 100 beats per minute. The rhyme is regular. The P wave is before each QRX complex, is similar, upright, and lead 2. The PR interval is 0.12 through 0.20 seconds constant. The QRX complex is 0.12 seconds. The QT interval is less than 0.44 seconds. The notes are, is seldom above 160 beats per minute, may be higher in children. Number 4 is sinus arrhythmia, and the heart rate is 60 to 100 beats per minute. The rhyme is irregular, phasic variation with respiration. The P wave is before each QRX complex, is similar, upright, and lead 2. The PR interval is 0.12 through 0.0 seconds constant. The QRX complex is less than 0.12 seconds. The QT interval is less than 0.44 seconds. The notes are the rate increases with inspiration and decreases with expiration. Number 5 is sinus pause less than 3 seconds and sinus arrest greater than 3 seconds. The heart rate is that of underlying rhyme. The rhyme is irregular. Pauses in rhyme occur when impulse fails to conduct from SA node. The P wave is absent when block at SA node occurs. The PR interval is that of underlying rhyme. The QRX complex is that of underlying rhyme. The QT interval is that of underlying rhyme. The QT interval is less than 0.44 seconds. And the notes are you must measure how long pause or arrest is. You must measure from R wave before to R wave after arrest. Count number of small squares and multiply by 0.44 seconds. Okay, now we are at the atrial family. And number 6 interpretation is premature atrial contraction, PAC. It originates in the atrial outside of SA node. The heart rate dependent on underlying rhyme. The rhyme is irregular due to PAC. The P wave is early, upright, and different from sinus waves. The PR interval dependent on underlying rhyme. QRX complex dependent on underlying rhyme. QT interval dependent on underlying rhyme. Nor notes. Number 7 is atrial fibrillation, AFib. The heart rate is less than 60 beats per minute for the slow ventricle response. It's 60 to 100 beats per minute for the controlled ventricle response. It's greater than 100 beats per minute, and that's the rapid ventricle response. The rhyme is irregularly irregular. The P wave is unidentifiable, erratic baseline. The PR interval is unmeasurable. The QRX complex is less than 0.12 seconds. The QT interval is unmeasurable. The notes are there are uneven baseline with many tiny P waves. Number 8 atrial flutter interpretation. The heart rate is 100 beats per minute. The rhyme is regular. The P wave is no P waves, S waves are present. Sawtooth pattern. The PR interval is unmeasurable. The QRX complex is less than 0.12 seconds. The QT interval is unmeasurable. Number 9 interpretation is atrial tachycardia. The heart rate is 140 to 250 beats per minute. The rhyme is regular. The P wave is unidentifiable, can't determine P waves from T waves. The PR interval is unmeasurable. The QRX complex is less than 0.12 seconds. And the QT interval is unmeasurable. There are no notes. Number 10 interpretation is supraventricular tachycardia, SVT. The heart rate is greater than 100 beats per minute. The rhyme is regular. The P wave is unidentifiable. The PR interval is unmeasurable. The QRX complex is less than 0.12 seconds, and the QT interval is unmeasurable. The notes are fast rhyme arising from above the ventricles. We're now at the junctional family. Number 11 interpretation is premature junctional complexes, PJC. The heart rate is dependent on underlying rhyme. The rhyme is irregular due to PJC. The P wave is rarely inverted or absent. The PR interval is dependent on underlying rhyme. The QRX complex is dependent on underlying rhyme. The QT interval is dependent on underlying rhyme. The miscellaneous notes are impulse arise from bundle of hits. Number 12 interpretation is junctional escape rhyme. The heart rate is 40 to 60 beats per minute. The rhyme is regular. The P wave is inverted or absent. The PR interval is less than 0.12 seconds if no P wave present, and is unmeasurable if no P wave present. The QRX complex is less than 0.12 seconds. The QT interval is less than 0.44 seconds. The notes are originates in the bundle of His. Number 13 interpretation is accelerated junctional rhyme. The heart rate is 60 to 100 beats per minute. The rhyme is regular. The P wave is inverted or absent. The PR interval is less than 0.12 seconds if no P wave present. Unmeasurable if no P wave present. QRX complex is less than 0.12 seconds. QT interval is less than 0.44 seconds. The notes are originates in the bundle of hits. Number 4 interpretation, junctional tachycardia. The heart rate is greater than 100 beats per minute. The rhyme is regular. The P wave inverted or absent. The PR interval is less than 0.12 seconds if no P wave present. Unmeasurable if no P wave present. QRX complex less than 0.12 seconds. QT interval less than 0.44 seconds. Notes originates in the bundle of His. Number 15 interpretation, premature ventricular contraction, PVC. The heart rate dependent on underlying rhyme. Rhyme irregular due to PVC. P wave absent. PR interval none, measured on the underlying rhyme. QRX complex greater than 0.12 seconds, early, wide, and bizarre beat. QT interval measured on the underlying rhyme. The notes, types of PVCs. Couplet is 2 PVCs in a row. Big and mini, every other beat is a PVC. Tricky mini, every third beat is a PVC. Quadri mini, every fourth beat is a PVC. Runner BTEC, 3 or more PVCs in a row. Now we're at the ventricle family. Number 16 interpretation is ventricular tachycardia, BTEC, monomorphic. The heart rate is above 100 beats per minute, wide, bizarre, QRX complexes. The rhyme is regular. The P wave is absent. The PR interval is not applicable. The QRX complex is greater than 0.12 seconds, early, wide, and bizarre. The QT interval is unmeasurable. There are no notes. Number 17 interpretation is torsades de pointes, twizzling of the points. polymorphic VTEC. The heart rate is 150 to 250 beats per minute. The rhyme is irregular. The P wave is absent. The PR interval is none. The QRX complex is greater than 0.12 seconds. There are no QT intervals, no notes. Number 18, interpretation is ventricular fibrillation, VFib. The heart rate is unmeasurable. The rhyme, no pattern or regularity, totally chaotic. The P wave is absent. The PR interval, there are none. The QRX complex is absent. QT interval, none. Miscellaneous notes, disorganized, chaotic, electrical rhyme, lethal. Number 19, interpretation is idioventricular rhyme, IVR. The heart rate is 20 to 40 beats per minute. The rhyme is regular. The P wave is none. The PR interval, unmeasurable. The QRX complex greater than 0.12 seconds, wide and bizarre. The QT interval greater than 0.44 seconds. The notes originates in the ventricles. Number 20, accelerated idioventricular rhyme, AIVR. AIVR. Heart rate 41 to 100 beats per minute, rhyme regular. P wave none. PR interval unmeasurable. QRX complex greater than 0.12 seconds, wide and bizarre. QT interval greater than 0.44 seconds. The notes originates in the ventricles. 21, Agno interpretation. Heart rate less than 20 beats per minute, rhyme regular. P wave present. PR interval unmeasurable. QRX complex absent. QT interval none. No notes. 22, isystole. Heart rate none. Rhyme flatline. P wave none. PR interval none. QRX complex none. QT interval no notes. The notes, miscellaneous notes, no electrical activity, patient has no pulse, start CPR. Now we're at the block family. Number 23, interpretation is first degree AV block. The heart rate is dependent on underlying rhyme. The rhyme is usually regular. The P wave is before each QRX complex. The PR interval is greater than 0.20 seconds, prolonged constant. The QRX complex is dependent on underlying rhyme. QT interval dependent on underlying rhyme. Number 24, interpretation, second degree AV block type 1. The heart rate is dependent on underlying rhyme. The rhyme is irregular. The P wave is upright and similar. The PR interval is greater than 0.20 seconds, progressively prolonged until P waves is not conducted, then repeats pattern. The QRX complex dependent on underlying rhyme. The QT interval dependent on underlying rhyme. No notes. Number 25, interpretation, second degree AV block type 2. The heart rate, dependent on underlying rhyme. The rhyme is irregular. The P wave upright, similar, more, 9 conducted P waves than QRX complexes. The PR interval is greater than 0.20 seconds, prolonged constant. The QRX complex is dependent on underlying rhyme. The QT interval dependent on underlying rhyme. No notes. Number 26, interpretation, third degree AV heart block. The heart rate dependent on underlying rhyme. The rhyme is regular. The P wave upright, similar, no relationship to QRX complex, more, non-conducted P waves. The PR interval greater than 0.20 seconds, varies, no pattern, no consistency. The QRX complex dependent on underlying rhyme. The QT interval dependent on underlying rhyme. No notes.